everyone, it's such an honor to meet you in this nice occasion. My name is Miki Wastiti and I am the representation of our team from State University of Surabaya. Today we would like to deliver a presentation with the title Perception and Behavioral Intention of the Young Generation Towards Telemedicine Services in the Era of the COVID-19 Pandemic. So here we go. The first is the introduction. The outbreak of COVID-19 has bring impact on the healthcare system. Telemedicine is aimed to ensure if the provision of cost-effective, timely, and fair services for everyone with secure communication between patients and the doctors. The importance of telemedicine became even more evident during the COVID-19 pandemic, as healthcare professionals worldwide communicate efficiently with their patients using virtual clinics. In Indonesia, this technology has only begun to be commonly used in recent years. The implementation of the telemedicine is based on the regulation of the Minister of Healthcare of the Republic of Indonesia number 46 of 2017 concerning the national e-health strategy. Because the level of urgency is in the use of telemedicine was reaffirmed by the issuance of the circular letter of the Minister of Health of the Republic of Indonesia number HK 02.01 garing Menkes garing 303 garing 2020 concerning in the implementation of health services through the utilization of information and communication technology in the framework of preventing the spread of coronavirus disease 2019. This regulation provides a reference in providing health services by utilizing information and communication technology to prevent the spread of COVID-19 in the form of telemedicine method. So the purpose of this study is to analyze the perception of the younger generation and their behavioral intention to use telemedicine services during the COVID-19 pandemic. The consideration to use young generation not only to analyze their perception but also to determine the behavioral intention of the young generation as the use of telemedicine in now and in the future. The methods we use is, the first is our study design. This research is survey research. The cross-sectional survey conducted is an anonymous online survey that can involve the younger generation of participants, namely students at a public university located in East Java, Indonesia. The selection of young people as respondents to determine the attitudes and behavior of using telemedicine in the future lies in the hands of the younger generation. An online survey using Microsoft Forms, the survey was conducted in July till August 2021. This study involved 175 students. All participants have agreed to be surveyed and fill out an online questionnaire. All data provided by participants in this study will be kept confidential and use the principles of anonymity and pseudonymity. In general, all the data obtained were analyzed using a general qualitative approach inductively. All incoming responses will be downloaded from Microsoft Forms and then processed using numeric processing software. The data is then analyzed grouped according to predetermined indicators and analyzed using a general qualitative approach inductively based on the responses given by the respondents. Gender factors in this study were excluded from data analysis, assuming equality between male and female participants. So here we go to the result. So this is the variable we use as a measurement. The first is perception of the usefulness of telemedicine, got 84%, which is very good. Second is perception of ease-use telemedicine, got 81%, which is very good. Third is perception of legal health insurance telemedicine platform, 55% enough. Perception of the quality of health services through medicine, 72% good. Cost perception of telemedicine services, 34% not good. Perception of the influence of the government and society in the use of telemedicine services got 75% good. Perception of the telemedicine supporting technology infrastructure, 58%, which is mean enough. So the average is 66 and the result is good. These measurements of respondents' perception of telemedicine services using 8 variables. Second is satisfaction and behavioral intention of telemedicine services users. The first is average satisfaction of respondents who have used telemedicine services. And second is average behavioral intention of respondents will use telemedicine services now and in the future. The satisfaction and attitude of using telemedicine services are shown in the average satisfaction of respondents having used telemedicine services as much as 4, a maximum value of 5, and the average behavioral intention to use telemedicine services now and in the future as much as 4.10, a maximum value of 5. So here we go the discussion. So to provision this healthcare system by telemedicine, the government has several cooperation with the companies like Dr. Sehat, Allo Doctor, Hello Doc, Sehat Q, Click Doctor, Good Doctor, and etc. Technological infrastructure that support telemedicine is indispensable, such as a stable internet and electricity network for the smooth implementation of telemedicine and to support the satisfaction of telemedicine users. The average shows that the younger generation perception of telemedicine services is reasonable based on the 7 variables telemedicine services according to needs, situations, and condition. This means that there is the behavioral intention, which indicates an individual's readiness to perform certain behaviors. In the younger generation, the use of technology and information system has become a habit so that the presence of telemedicine can be well received. It appears that this behavioral intention explains the behavior of the majority of adopters concerned with the convenience and usefulness, such as helping them manage their health better. And they believe technology can be used effectively to communicate with healthcare providers for medical needs. Telemedicine used telemedicine services during the pandemic and after the passing of the COVID-19 pandemic. Telemedicine has become a new habit. However, certain services that cannot be used with telemedicine are still required to be done clinically. In the future, telemedicine services will continue to be designed not to replace visit to doctors, but as a comparison to treatment that is getting better, more efficient, and appropriate. So the conclusion is the study obtained two results, namely the first about perception seen from 7 measurement variables, namely usability, convenience, health, legal insurance, quality of health service, cost, government and society, and supporting technology infrastructure. It was found that the average respondents' answers was 66% categories as good, meaning the perception of the generation young people about telemedicine services are well received. The second result found that the average behavioral intention of respondents to use telemedicine services now and in the future is 4.10 of 5, or the category agrees, or the category is agrees. This means that there is a behavioral intention that indicates individuals' readiness to use telemedicine services during the pandemic and after the passing of the COVID-19 pandemic. Telemedicine has become a new habit. So thank you. If you have any question, please let me know. And bye-bye.